So today's Cardinal lesson, we're talking about Medicare. And CMS just released, the government just released all the 2024 stuff for Medicare. The change in deductibles, the change in copayments, the change in the Part B premiums, the changes in IRMA. And so this could be a pretty short video if all we were doing was announcing that stuff. Okay. And you may have seen this a few weeks ago, but we take this stuff real seriously because you can put together trends. And Medicare is really the second thing on our chart here that when people come into us for financial planning, retirement planning, I mean, we're dealing with Social Security and Medicare right off the bat. And so we're going to go over the 2024 stuff, but I really want to bring Tom on, and he's going to talk about why we're doing this video.
Yeah, I mean, we're doing this video because the average person who comes in here knows very little about Medicare, and what they do know is often wrong. It's mixed up with different parts. They don't have a real clear picture here. And so what we want to do and what we do in our practice is really make sure we understand how this works before we start making any decisions. Because it's really hard to make a good decision if you don't even know what you're deciding between. So really what we want to do today, walk through how Medicare works, walk through what the different parts are, and then talk about what those changes are for next year. I do want to bring up the show notes that we have here. We're not going to spend a lot of time today in these notes, but you can find these at the link below on our video. They're also on our website under the Learning Center. Again, we have the board. We have some of the data that the Centers of Medicare and Medicaid Services release. So it's just sort of their press release. It goes into more than numbers, but if you want more information, find them in the show notes. But we're trying to do a pretty good job summarizing it in the rest of the video.
Okay, so what's going on for 2024 is they raised the hospital deductible to $1,632. So if you're on original Medicare and you have no supplement, which is few people, but the best way to understand original Medicare parts A and B is to pretend you don't have a supplement, which it's going to show you what you'd have out of pocket. So this $1,632 deductible is every time you go in the hospital. So it's possible to pay it twice in a year. Not really that likely, but possible, even more than that in a year. And then the nice thing about that is that covers 60 days in the hospital. So your only out of pocket would be $1,632. And by the way, if you have a Medicare supplement, it pays the $1,632. If you have the Plan G and you have the highest supplement. So I'm not going over the amounts and the changes to get you worried about them because most people have a supplement that pays this, or they're on a Medicare Advantage plan. And I want to go over this down here on the bottom is if you have a Medicare Advantage plan, the only part of this presentation of these changes in the numbers that applies to you is the monthly premium for your Part B. So if you've transitioned onto a Medicare Advantage plan from original Medicare, you still have to pay your Part B premium. And that in 2024 is going to be $174.70 a month for most people. And then 7% of the population, or the Medicare population, pays this IRMA, which is extra. It's like a Medicare tax. And we did a video on that 2 weeks ago. So if you just search in our YouTube channel and you want a whole explanation of IRMA and the IRMA numbers in 2024, but for the purposes of this video, the only thing of all this that applies to you if you're on a Medicare Advantage plan is just the Part B premium and the IRMA. So this video is mostly for people who are on original Medicare, like me. This is what I'm on. I went on in July when I turned 65. That it applies to them, and then most of them don't have to worry about most of these deductibles because they have a Plan G supplement, or they have a supplement that pays these deductibles and copayments, most of them. So we're going to go through the changes understanding that most people have insurance to protect themselves. $1,632 Part A deductible after the 60th day in the hospital, from the 61st to the 90th day, $408 a day is your out of pocket. So that's pretty substantial for somebody that's in there for a long time. And then when you reach the 90th day, that becomes $816 a day out of your pocket. And then after 150 days in the hospital, you're out of benefits under Part A. I mean, it's just, now the great news is the supplement pays all three of these, and it also picks up a whole nother year, another 365 days in the hospital if you exceeded 150 days. So, I'm going over the problem and then I'm solving it. Now, under Part B, it's not as simple. Under Part B, which is your doctor and outpatient, and a lot of people now, you don't even go in the hospital when you have surgery, and you can spend a whole lot of money as an outpatient. It's all going to fall under Part B. You've got the annual deductible has gone up to $240. And this is the one thing that is not covered on the whole board by the Plan G supplement. It is covered under the Plan F, but those of you that have gotten on Medicare for the first time, 2020 or after, you can't buy an F. But if you went on Medicare before 2020, you can actually buy an F plan, and that F plan pays the $240. But not to make things confusing, the $240 is something that you've got to concern yourself with if you have original Medicare and a Plan G. It's not a huge amount. It's just the first few times you go to the doctor, it's going to be on you. Then after you've met that deductible, you have a co-insurance of 20%. That hasn't changed for 2024. And what also hasn't changed, there's no cap on the 20% in original Medicare. This is where people that didn't have a supplement that were on original Medicare could run into huge problems, because there's no limit or upper limit on the out-of-pocket for the 20%. So you could have $100,000 in Part B outpatient charges, and Medicare is paying 80% of them. You're paying 20% or $20,000. So the good news is the supplement, for the most part, pay those, and the Plan G pays all of them. They'll even pay excess charges. Then you have the monthly premium, which we talked about earlier. The monthly premium, that if you're on Social Security, they just take this out of your Social Security check. If you haven't started your Social Security yet, you have to actually pay that, and they'll ask for it quarterly. And if you have a high income, you're going to pay this $174.70 plus a bunch more under IRMA. And like I said, you can go to another video and you can learn about that. So I want to bring Tom back on. And first of all, I want Tom to comment on some of the things I've gone over. And we're just going to talk about some of the difficulties that people seem to run into in working with Medicare from our client's perspective.
Yeah, I mean, I think one thing that you had mentioned earlier that is really important to understand, that a lot of people just fundamentally do not get this, is that a Medicare Advantage plan and a Medicare supplement are just fundamentally different. They are not the same. You cannot have both. They do not work together the same way at all. And if you have one, you cannot use the other. And if you don't understand that, you need to go back. We have videos that go in more depth there. But you need to understand that piece before you start making decisions, because a lot of people will hear all these, ads on TV and things that are mostly talking about Medicare Advantage plans. They have all these extra benefits, dental, vision, maybe gym membership stuff. And that's what they sign up for. They says, oh, that sounds great. And I get it for no premium, $0. Wonderful. And while you're healthy, it works great. The problem becomes is when you get sick, you now have to deal with networks. You have to deal with, seeing the doctors that they tell you can see. You got out-of-pocket costs. If you were to get very sick, it could be much more expensive on the Advantage plan versus supplement. Not saying Advantage plans are bad. We just want you to know the difference before you pick one and sign up, and not just go for the shiny object that's first presented to you. That's a big area that we often see. And a lot of times people will confuse they've heard things about Medicare and they're really talking about Medicare Advantage, and they apply that to Medicare supplements. And you just really need to know the difference between those two. So I think that's a big area that if we really could teach you something, that would be the main one we'd want to focus on. I think sort of for the rest of the video, what we want to do is talk about some of the mistakes. What are some of the biggest mistakes that we see people make when it comes to Medicare? The one I just went over is a big one, is signing up for one, not knowing really the differences between the two. Another main one that I've seen, and I'm dealing with this right now with the family member, is they retired, they delayed Medicare Part B, they did all that piece of it right. They retired and they didn't sign up for Part B of Medicare at that point. And that can be very problematic. And so they sort of think they have everything set up. They knew they wanted a supplement. They signed up for a supplement. They got the drug plan and they went to go to use it at the doctor's office. And the doctor says, "Oh, you don't have any coverage," because they never signed up for Part B of Medicare. They didn't call me when they should have, but we're fixing it. It's okay for them. But if you're in that situation and you retire, you absolutely need to sign up for Part B, because none of this will work without Part B of Medicare. And so that would be one thing you want to make sure you avoid.
Yeah, and you know that you have to pay for Part B. It has a cost to it, and like I said, 93% of the people are going to pay 174.70 per month for their Part B. So that's one way to know if you have Part B, is you can just look at your card and it'll say it on there, and you can look at your Social Security check and they're taking it out, and that amount changes every year. Now you may be paying more than the 174.70. That's a good sign that you got IRMA. But on this topic that Tom brought up of knowing the difference between original Medicare and a supplement and an Advantage plan, those are two different routes, and that's one of the first places we go with people coming into us, and that's how we know that a lot of folks don't know the difference between the two. This is a binary choice. And then during annual enrollment, which we're going through right now, it's that season, you have the opportunity to remake this choice. And what we see happen a lot is people end up on these Advantage plans and they've never really looked at the alternative of staying on original Medicare and buying a supplement. And they've gotten there through talking to their friends that are a little older, and they're saying, "Oh, well, all my friends have this XYZ Medicare Advantage and they love it. They just love it." And, the question that I have, and I kind of go with this gently, are any of your friends sick? Are they bad off in their health? Which really means that they're using their plan a lot. Yeah, and I'm not saying they're going to speak badly about their Medicare Advantage plan, but just to take a survey of your friends who are all healthy and they're using the gym membership, they're using the dental benefits, they're using all the extras, but they're not fundamentally testing the health insurance and the core benefits, which again, I'm not saying they're bad, but if people are going to run into network problems many times and they're going to be frustrated and they're going to learn new things. So what we want to do for all of our clients is just show them all the options and explain the downside of all the options, is what it really boils down to. Because going with original Medicare and a supplement, it has its downsides too. Is these supplements can be expensive and they can go up in premium over the years. Um, they and then if you're in poor health, you're going to have difficulty changing to one with a lower premium. They don't include dental benefits like the Advantage plans do. They don't include vision. So there is no exact route, or there's not one that's better than the other. What we want to do for people that are coming into us is look at their situation, what their preferences, what their financial situation is, and how they want to receive care, what their area is like, if they have a lot of choices in doctors and hospitals, if they might go to a research hospital if they got seriously sick. I mean, there's a whole bunch of factors in there, and that's going to help us guide them of which route to take. And I think that one of the mistakes, as Tom had talked about, let's bring Tom back on. And I think for this mistake of not knowing the difference between the two, and then not knowing all the options within those differences. What do you have to say about that, Tom?
Yeah, I mean, I think it's very apparent when we have people come in that are doing financial plans and we ask them, "Well, what do you have for Medicare?" And they might say something like, "Oh, I have Humana, I have Aetna." It's like, "Well, what type of plan?" And they sort of look at us with a puzzled look of like, "What do you mean, what type of plan?" I have Aetna, that's who I have. And it's like, "Well, we need you to get out your card. Let's really look at this. You know, you should know that you should know the two, and you should know which route you've picked. And most people just don't, right? I mean, they got in touch with somebody when they were first signing up, whether that was someone they knew, someone sent them, they responded to something in the mail, someone knocked on their door. But they were never presented with both choices and never made an informed decision. So even if you've already made this choice, it might be time to revisit this, look at it, and just make sure you're on the right path for you. And this is the time of year that you can make a change, especially on the Advantage plans, if you want to go back to your original Medicare. But again, this is, you need to know the difference so you can make an informed decision.
Okay. So we want to go through here on the board. I mean, we talked about Medicare the whole video, but we also, you go to the Social Security Administration and SSA.gov, the two are intertwined. What I will say within Medicare, it doesn't pay for long-term care. So let's just clear that up. That's news to some people. And then we've talked a little bit about taxes because this IRMA is a bit of a hidden tax. And that's kind of it. So I want to bring Tom back on. I'm Hans Scheil, and we thank you very much for listening to us.
Thank you.